I think I decided to become a doctor when I was a kid, actually. I grew up just a couple blocks away from my dad's primary care practice down on Grand Avenue, actually. And I spent most of my time, doing some work around the office and answering the phones at the office and at home because patients would call the house too. And I think, I just really came to realize that that's what I wanted to do with my life. And so I just really enjoy taking care of people. I think the reason that I chose family medicine over anything else is because it really focuses on the whole person and taking care of really complicated issues, but in the context of the whole person. And actually in college, I studied accounting and did a bunch of work in different fields in accounting as well. And that helped me to sort of realize, how to put together really complicated issues and look at the numbers, but take it in context. And I think when I brought that over to medicine, that really helped me to take better care of people. What I find most rewarding is helping people to reach their goals with their health. And so that usually means, figuring out what that person, wants to achieve with their health and also bringing in what I think we should be talking about too and bringing that together and having that conversation. And that's really rewarding to kind of bring that, all the way. Well, if I wasn't a doctor, I'd probably still be a corporate tax auditor, which is what I was doing before I went to medical school. What I really like to do when I'm not at work is go for a bike ride. And I'm a big cyclist. I like taking my family out for rides. I like getting my tandem out and putting my chariot on that, taking my kid and my wife for a ride. The last book that I read was Goodnight Construction Site. I read books to my kid every night, and I think last night we read Goodnight Construction Site last. I'd have to say that I'm an Iowa fan, unfortunately for the Iowa State fans. But I went to Iowa for medical school, and I really enjoyed it there. Really great place. But we have a lot of ISU fans in the office too, so that should be okay. My philosophy towards patient care is really to take care of the whole person, and that usually means taking their goals into account and also talking about all of the screening and testing and treatments that are based on evidence. And so that involves talking about the numbers quite a bit, but also taking it into context and really trying to bring it together and take care of the patient based on what their goals are.